The Fox 61 Morning News, everyone. It is 9:12 here on your Monday morning. October is a time to shed light on breast cancer and its impact on yourself and your family. Now, according to the Center for Disease Control, breast cancer is the second most common cancer among women here in the United States. Each year in the U.S., about 255,000 cases of breast cancer are diagnosed in women and about 2,300 in men. So today we wanted to educate all of our viewers about prevention because that is key here. So joining me this morning to talk about this is advanced practice registered nurse Tracy Noell. Tracy, thanks so much for taking the time.
You're welcome. Thanks for having me.
Of course. Now we all know everyone gets dressed up in pink. They wear their ribbons each and every year in October. But let's talk about some of the symptoms of breast cancer because maybe people don't know what to look out for.
Absolutely. I think first and foremost, what everybody knows about is finding that lump in your breast or finding a lump in your armpit. That would be considered abnormal and something to have checked out. The other really important thing to do is to pay attention to the skin in the breast, right? We see dimpling of the skin, pulling of the skin. So very important to take a look at that, along with any nipple discharge that might occur that's not breast milk. So that's also very important, along with pain. Pain is not necessarily normal as well.
Now, what can women and even men do to reduce their risk of breast cancer?
So really important is lifestyle, right? There are uncontrollable risk factors like simply being a woman or being over the age of 50, which we know are risk factors. But lifestyle changes, we know that that higher risk occurs in patients who are overweight or obese, exercise regularly, people who drink a heavy amount of alcohol, as well as smokers. So making some good lifestyle changes will certainly help lower your risk.
And it goes without saying that lifestyle changes not only reduce your risk of breast cancer, but of other things like obesity, heart problems, things like that as well. Now, you did stress about the mammogram, and I know that there are differing opinions on this, but when is a good time to start getting a mammogram, and how important is it that women start to get, and even men get mammograms each and every year?
So we have a couple of different screening guidelines. One comes from the United States Preventative Service Task Force, and that one says to start screening at around age 50. The American Cancer Society recommends that we start offering mammogram to women at age 40. And I think that it's really important that women understand that that's a very personal and individual discussion that they should have with their healthcare provider as to when they start screening mammograms. But screening is vital in terms of finding that breast cancer early and getting it treated.
Absolutely. And my last question to you, because this is so important because there are so many different factors that come into how breast cancer is treated. What is a treatment like when someone does get diagnosed with breast cancer?
So it really depends on the kind of cancer that it is. It can be as simple as surgery. It can be surgery with chemotherapy or radiation. It could also be treated with hormones. So it really is quite dependent on the kind of cancer that it is.
And I know that several studies have shown that the risk of breast cancer and the rate of breast cancer has gone down. So this is good news for us as technology and awareness all increase as well. Tracy, we thank you so much for your time this morning. We really appreciate it, kicking off Breast Cancer Awareness Month and really spreading the word.